A lot of patients, I get questions about very similar thing. Are there any other drugs outside of chemotherapy, molecular therapy, the scientific, that can help me? Sometimes you read about things that, oh, this plant extract or this medication, improved the leukemia. And usually I don't say that this is absolutely wrong or that I know for sure that this is not. The only problem is the reason we do these rigorous clinical investigation and trials is to try to tease out, because even in our field with a lot expert scientists doing research, for almost every 10 to 15 drugs that we bring through 5 years of research, which looks very promising, only one really makes it to clinic. So that shows that even when you have huge academic centers doing research with some of the smartest people in the country, you can only get a 5 to 10% success rate. And so that's why a lot of physicians are inherently skeptic when they hear that, oh, we tried this in 5 patients and it worked and this is it. And we say put it into a clinical trial, and we've done that with some other products. So that's the more maybe cautious side of it. Now, the things that definitely help, and I've seen a lot of patients benefit from it, is exercise. I think exercise and diet will definitely, it's not going to directly impact the leukemia, it's not going to make it go away, shrink, or reduce the blast percentage, but it will improve your outlook. It'll improve the compliance. The patients come very regularly, those who are mentally in a better frame of mind because of exercise and dieting, and it will improve your tolerance to get these drugs. Because if you're already weak, or if you're already obese, or if you're already having a poor diet, then when you get a chemotherapy, which is intensive effect on your body, and it is puts strain, you're not going to handle it as well. So those people who try to make a more healthy lifestyle or a better diet have better resilience, and often are the ones we can give the full doses of the chemotherapy in the appropriate timeline, and I think that can improve by 10 to 15% the overall outcome. So I highly encourage, and now again, exercise doesn't mean that somebody who's getting chemotherapy for AML should go run 45 minutes. It could be a 30-minute brisk walk every other day. If you have a treadmill and you like to do that, you could do slow treadmill. You could swim, but some level of activity, because the inherent tendencies when you get chemotherapy is to feel tired and to try to sleep. And it's a paradox where I actually tell my patients you should not do that. Even when they're in the hospital, unless they're very sick or on oxygen, I tell them, look, the bed is only for sleeping. If you're tired, sit in the chair, watch TV like you would do at home. Make a few laps around the ward. Have your family come over, walk with them down to the cafeteria. And I think some patients who are inherently very good at doing that, they have I have patients who are just have been active all their life and they just want to move. They always get out of the hospital faster, I feel. They always get over infections quicker, and they just seem to do better overall. So this is kind of what we, in objective terms, call performance status. And the performance status is not fixed. Your age is fixed, your chromosomes that are there in the leukemia are fixed, molecular fixed. The performance status can be improved by the patient with activity, with healthy lifestyle, with optimistic outlook. So I think exercise is probably the one thing I would recommend to patients, to try to keep doing that and stay active.